We saw that African, Black, and Caribbean folks were already undergoing a massive mental health crisis, and these things were only exacerbated by the restrictions that we were having during the pandemic, as well as the situations and circumstances that were occurring around George Floyd. And these things tend to have a long-lasting effect on the community at large and how that affects our mental health. For this project, the intent was to create a program that would provide a space for African, Black, and Caribbean folks living in the Peel region to kind of build their emotional resilience, build strength, and build a positive self-identity. And we've done this through creating a 6-week hybrid program called Theater for Positive Mental Health, a space where they could come and be themselves and tell their stories, but not only tell their stories, but reconstruct their stories.
So what motivated us to develop this project was the lack of culturally appropriate services for African, Caribbean, and Black communities within the region of Peel. So we use participatory theater as a tool of resistance for participants to devise and improvise ways to navigate institutional systems where they may experience various kinds of oppression. One of the things I really enjoyed about this project was just being able to have really in-depth discussions about Black mental health and racism in ways that we don't usually get to have. And a lot of the participants are so knowledgeable about these issues. So it was almost kind of like cathartic being able to be in a space where we could just unapologetically vent and talk about these things. Also, engaging in self-care and self-love. There's a quote by Audre Lorde that talks about how self-care and self-love is an act of resistance. And I think that's so necessary within the Black communities to find ways, racism does exist. It may not ever go away, but there's ways for us to thrive and take care of ourselves in these systems of oppression.
Those are very specific to Black communities, and that's why our project is going to make a difference, because we highlight those challenges that are very context specific. Our major aim is to see culture and religious diversification in the mental health care system,
as well as service providers to be more culturally informed and more trauma informed on Black mental health so as to not further perpetuate and marginalize members within the ACB community.
And that's what the bigger picture of this program is. We want to take the learnings from this program, create some culturally competent trainings for service providers in the Peel region, and then ultimately provide that training so that the community members feel comfortable coming back to our service providers and asking for help and asking for culturally competent care.